Hello, thank you for being here. My name is Peggy Gallatly. I live in Calhoun County. I am a weekly church attender. I'm active in the local hospital auxiliary, have never been arrested, have always paid and filed my taxes timely. I worked in the medical field, did drug testing in a toxicology lab, which was NIDA approved. I am a paralegal and finally was a claims adjuster on workers' compensation for 15 years. I also was a medical marijuana patient in California. I moved to Iowa 2 years ago from California where I had a medical prescription. How bizarre to go from a legal medical cannabis state to a state where felony incarceration is the penalty for use of this non-toxic medication. In Iowa, I would have to commit a felony and pay more than 4 times as much on the black market to obtain the same amount of cannabis as I paid at a dispensary in California. This is sad, as Iowa is a wonderful place to live otherwise. I love it here. I'll never move back to California, regardless of what you do. In 2005, I was down to 120 pounds due to my medical issues. I was on medication to counteract the side effects of my medications. I was stool incontinent, suffered from pancreas attacks, and tremors from Depakote. I then tried a series of other meds after being taken off Depakote and merely gained 80 pounds due to the medications, such as Zyprexa. Thank God I went off it right away. I put 35 pounds on in 6 weeks. That causes diabetes. Finally, I got my medical card and used cannabis to treat my mania from bipolar disorder and anxiety disorders. It also helped with my intermittent hiccups. If you've ever suffered from hiccups that don't go away, it's horrible. Insomnia and my chronic pain syndrome. It enhances my prescription pain medications, and I do not require opiates. I'm a witch with a B on opiates. I do not like them. My elevated liver enzymes did not come from cannabis, and I do not even drink, so it wasn't from alcohol. My nephew has glaucoma and was on medications that weren't very effective and were very, very costly. He told me they were over $2,000 a month. He was advised to try medical cannabis, got his card, and has better results without the side effects and high cost. My friend with MS also moved to a state where this medicine is not available, and he misses his pain relief. I had a neighbor in California who was a retired city firefighter and Vietnam vet. He was on several psychotropic meds with marginal relief and sexual side effects. His wife had left him. I told him about medical cannabis. He got his card. He eventually was off his meds, reconnected with his wife, and was happier than I'd ever seen him before. My son is 30 years old. I'm sorry, I get cotton mouth from my medication. My son is 30 years old. He came here with me today. He has chronic pain from inoperable tumors on his spine. He also had a medical prescription, but in Iowa that doesn't help him with his chronic pain. He also suffers from severe chronic depression and anxiety. He also has lost his best medicine. My sister died of mesothelioma, which is a cancer caused by asbestos, after a 4-year battle, which is really almost a record length for living with that disease. Early on, she tried cannabis, but was unable to smoke it due to her diseased pleural cavity. Thus, she was unable to benefit from the valuable benefits, as medical cannabis was unavailable to her. Had it been legal, she could have purchased soup mix, honey, tea, baked products at a legal dispensary. They had medical marijuana brownies and everything else. All she could get down was ice cream. How sad that she didn't live to see legalization. My experience as a cannabis patient was the product purchased was clearly labeled for medicinal use only. Keep out of the reach of children. It was not easy to get a prescription. Doctors were afraid of being dropped from their malpractice policies or being somehow penalized for prescribing something federally illegal. So I was referred to a doctor that dedicated his practice to determining medical need for cannabis. Several patients there were not prescribed what they sought, as they did not medically qualify. It was not easy to get into a dispensary even with a prescription. My prescription looked like this. Had my driver's license on it, phone number, the name of the doctor's signature. took that to my dispensary. Once I got verified, which wasn't the first time I went, and I had to drive, 100 miles to the dispensary from where I lived. There were not a lot of them around. I had to show my driver's license as well as my prescription to gain entry inside. I could not take a camera or a cell phone inside the dispensary. Only persons with a prescription were even allowed to work there. We were only allowed to smoke in private residences. My father watches Fox News, and he told me that if they legalized medical marijuana in Iowa, we'd be smoking in restaurants. I assured him that was not true. I was allowed to grow my own, but only on my own property and behind a locked fence. I noticed that typical persons looked ill, or much like myself, at the dispensaries. Doctors should not be afraid to prescribe this God-given medicinal plant, which ironically is not as toxic as most pharmaceuticals. I never had to take meds to relieve side effects of this medicine. I beg you to thoroughly investigate research and statistics from other countries